Hi, my name is Lisette, and I'm going to talk about epidemiology of acute kidney injury in critical old children and young adults. Definition: acute kidney injury is a sudden episode of kidney failure of kidney damage that happens within a few hours or a few days. AKI causes a building of waste product in your blood and make it hard for your kidney to keep the right balance of fluid in your body. Let's see a video.
Acute kidney injury is an acute condition. It happens rapidly. It causes a loss of renal function. It affects millions of Americans, more than 1 million Americans a year. It causes a doubling of the hospital mortality and hospital length of stay, and costs millions, in fact, billions of dollars in cost to care for them. And it causes long-term disability in terms of chronic kidney disease, need for dialysis, and conditions like increased risk for cardiovascular disease. It's very difficult to diagnose, which is part of the problem for treatment.
Application in nursing. Nurses, wherever they work, they have a vital role to play in the prevention, detection, and treatment of AKI, monitor fluid and electrolyte balance, producing metabolic rate, promoting pulmonary function, preventing infection.
Hey everyone, it's Sarah, registerednursern.com, and in this video I'm going to be doing an NCLEX review over acute kidney injury, also known as acute renal failure. And this video is part of an NCLEX review series over the renal system. And don't forget to check out at the end of this YouTube video the quiz that will test you on acute kidney injury. So let's get started. So what is this condition? This is where there's a sudden decrease in renal function. So it comes on quickly and the kidneys aren't able to filter the blood like it should. And because of this, you get buildup of waste in the blood, like
Pros and cons. Advantage: treatment and cure exist. This pathology can be prevented. Disadvantage: treatment for AKI usually requires you to stay in the hospital. How long you will stay in the hospital depends on the causes of your AKI and how quickly your kidney recovers.
Acute kidney injury, or AKI, is when the kidney's not functioning at 100%, and that decrease in function usually develops relatively quickly, typically over the course of a few days. Actually, AKI used to be known as acute renal failure, or ARF, but AKI is a broader term that also includes subtle decreases in kidney function. AKI can essentially be split into 3 types: pre-renal AKI, meaning the cause of the kidney injury is coming before the kidneys; post-renal AKI, meaning after the kidneys; or intrarenal AKI, meaning within the kidneys. Now, the
Issue applied in Ecuador. AKI affects approximately 1% of patients on admission to the hospital, 2% to 5% during the hospital stay, and 4% to 15% after cardiopulmonary bypass surgery.
So I think from a basic science standpoint, we need to figure out what exactly the mechanism is for why this combination causes more acute kidney injury than either of the two components alone. So back to the bench, basically, to figure out what exactly that mechanism is. From a clinical standpoint, I think making sure that we have antimicrobial stewardship teams looking at a narrowing therapy before day 4 to 7, and making sure that we can decrease the acute kidney injury incidence that way by narrowing therapy and getting stewardship teams on board.
Conclusion. Acute kidney injury is common and is associated with poor outcomes, including increased mortality among critical ill children and young adults.
So I'll be talking about acute kidney injury. The goals for the next half hour are as follows. I'd like to introduce you to some of the new terminology of acute renal failure, which has now been renamed acute kidney injury, talk about the most recent consensus definition of acute kidney injury. Then I'll introduce the incidence, mortality, and the excess costs that are associated with acute kidney injury, or AKI, provide you a general approach to the patient with acute kidney injury, and then go over some specific clinical scenarios that you've probably seen in your practice and that you may see on the board exam or recertification exam. Let me begin with a case just to frame our discussion, and we'll be returning